We are very happy to have Shailaja Teacher, the Minister of Health, Social Justice and Women and Child Development of Kerala State, India, and we will all see why we are so happy to have you here, Madam. I would like now to go to my very, very dear co-gender in this panel, Madam Shailaja Teacher. I know that that's how people are referring mainly to you, but also UK's Prospect magazine recently named you a top thinker of 2020 due to your amazing efforts to flatten the COVID-19 curve in Kerala State. And I think we all were able to read and see your work, your achievements, and your vision. So while while accomplishing all this in terms of the COVID, I know that as well Kerala State managed to maintain the TB services during COVID-19. How have you managed to do this? How have you managed to integrate COVID-19 and TB efforts and to really be able to really follow so amazingly on both of them? Madam, thank you for being with us, and if you can just share your thoughts with us. Thank you.
Madam, first of all, I want to convey my greetings to all on behalf of people of Kerala. We proudly call the God's own country. The development indicators of our state have always been comparable with that of many developed countries. Life expectancy of 79 years, infant mortality rate of 7, maternal mortality ratio of 42 are some examples. People's health has always been the highest priority of my government. To achieve that, we have a well-decentralized public health system with active engagement of community at grassroots level. Apart from the primary, secondary, and tertiary care network, with a very high female literacy and women empowerment, we have built a resilient community-based system for health. Eliminating TB is the priority for the state. Kerala changed from the traditional TB control mode to the TB elimination mode since 2017. We have developed a customized TB elimination strategy named People's Movement Against TB in Kerala like a mission. With this, the state government and the local governments at district, sub-district and village levels have formed TB elimination task forces for local planning and action. We have mapped 13 locally relevant TB vulnerabilities of our citizens. Happy to note that the survey started with my family and used this information and documents for focused surveillance and active TB case finding. We have educated all citizens on TB by door-to-door campaign under People's Movement, which also work well in alleviating the stigma. We have also established TB treatment support groups at every lowest local government level to provide decent, confidential and humane treatment adherence support and brought down our lost follow-up rates to negligible levels. We have very low levels of drug resistance. We provide TB pensions of nearly $15 per month to every TB affected citizens as a support for better nutrition in addition to the central government support. We have also established a system for TB elimination in private sector. We call it STEPS, means System for TB Elimination in Private Sector, that is STEPS. And to provide free diagnosis and management of TB in health facility of patient's choice. We provide free access to rapid molecular tests and TB drugs in private hospitals too. We have established a systematic surveillance of TB drug sales for a target-based monitoring and to identify and engage the private practitioners. Through all of this, 100% private providers have been engaged in this people's movement against TB. That is a great success. Through all these interventions, we have brought down our TB burden from 125 cases per 100,000 to 70 per 100,000 over 10 years. Nearly half of our local self-government divisions are free of TB among under 5 children. As the next critical step in TB elimination, we are launching massive TB preventive treatment in a campaign mode according to the Sustainable Development Goal declared by UN. Chronic respiratory diseases and significantly to the morbidity of add to the morbidity of the state. We have established a customized model of practical approach to lung health named SWAS, and we practiced it in each primary health centers. We started SWAS clinics there in primary health center, meaning healthy breath, that provides a comprehensive lung health care at primary level itself. COVID-19 pandemic has posed many challenges to the health system. Kerala has reported the first 3 cases of COVID-19 in India during early January, that the return is from Wuhan. However, we have been successful in flattening the curve and minimizing the death with a case fatality rate of 0.4%. COVID-19 had posed challenges to TB care also. During April, the whole country underwent a complete lockdown. TB diagnosis has dropped to 40%. However, we ensured that no diagnosed patient missed a single dose by ensuring doorstep delivery of TB drugs using our health staff and network community volunteers. Soon, we caught up on diagnosis and covered 80% of the targeted case during the COVID scenario. For this, we enhanced the existed specimen transformation system also, expanded diagnostic network of gene expert machines and TrueNat with central and state funding, established biosafety cabinets in diagnostic facilities and increased staff availability. We instituted bidirectional screening for TB and COVID. TB vulnerability mapping has helped in identifying and protecting the COVID vulnerable also. STEPS has helped in providing TB services for more people in private sector, compensating for the redeployment of public service health force for COVID-19. It has resulted in an increase in TB care in private sector compared to previous years. Happy to note that the TB case fatality has not increased during the pandemic period. People's movement against TB in Kerala is a long journey. We commit ourselves to set feasible models for saving lives and eliminating TB. We work for ending TB not just with our brains, but lot more with our hearts. We believe no amount of money can replace the lives of the loved ones, and we don't accept resource constraints as a reason for not doing the right things at the right time to save lives. And we do believe we can end TB. The menace is still killing millions of our brethren throughout the world. We acknowledge the great support provided to the state by national government and global TB community, and wish USAID Global Accelerator for ending TB great success. Thank you all.
Thank you so much. Really, thank you so much for all the efforts you do there, for what you shared with us. And when you said that we fight this with our hearts more than our brains, I think, you melted all of us. So thank you so much, Madam. And we are really looking at the contributions from the government side